Good afternoon. It's January 6th, Wednesday, 2021. My name is Kemal Erkan. I'm the chairman of American Surgery Center and United Medical ACO. This is our weekly event, as we promised for 2021. We'll keep these events on a regular basis. Wednesday and Friday, we have our United Medical ACO event as well at noon. Today I have Dr. Irgau as usual with me, and you guys already know who he is, but I will still ask him to just introduce himself.
Thank you, Kemal. Happy New Year. I am Dr. Irgau. I am the president and co-founder of the Christiana Institute of Advanced Surgery, or CHRIAS. It is a surgical practice whose main specialty is weight loss surgery, which is bariatric surgery. We have been performing bariatric surgery now for almost 20 years. We are the most experienced practice when it comes to bariatric surgery in our area, and it's always a pleasure to be here, Kemal.
Thank you, Dr. Erkan. So we are going to actually go back to what we discussed last week, just because the topic actually is interesting in a way that many people still have their perception of this fasting. Now, fasting is something that we are already familiar with. Many religions actually do have some type of fasting, right?
Absolutely.
So now we always question the benefit of why we do it, and the purpose may be sometimes different. But when I was introduced to intermittent diet initially by you, I had my questions and my doubts in my mind. And that changed. This was about a year ago, maybe a little more than a year ago. So now we want to kind of look into this intermittent diet fasting from the bariatric patient standpoint again. Now,
absolutely,
we probably need more education, Dr. Irgau. So that's kind of like what I'm hearing from different people. So if you can, before we actually start, if you can maybe introduce our other physicians in the program so that our followers can actually see who they are.
Absolutely. So as I said, I am the president of CHRIAS, the Christiana Institute of Advanced Surgery. The other surgeons in our practice include Dr. Gail Wynn, Dr. Michael Peters, Dr. Rahul Singh, and then Dr. George Ibrahim in terms of weight loss surgery or bariatric surgery. Dr. Sachin Vaid is a colorectal surgeon, a specialist in the colorectal area of surgery in our practice. And then Sydney Ondrasik, she is the physician assistant in our practice.
Thank you, Dr. Irgau. And then we have our dietitians, Fran, Amy, and Beth. So they work with our patients in the program very closely from the time that they get the consult to the end of the time of their surgery, and even after the surgery in many cases, because in some cases we all need regular support from our providers, and they are available for that. Now, again, before we start with the topic, I just, since this is the first event of the year, I do want to mention the reason American Surgery Center is different than any other bariatric programs in the country. We are a surgery center, and it's bariatric surgery in the surgery centers is not necessarily common because we have the most experienced physicians, surgeons. We did not have any issues starting this in our surgery center in 2018. This was April 2018. Since then, initial year, we completed about 200 cases. We normally do about 900 cases a year prior to this, and we reduced the number pretty significantly just so that we can actually take this experience to a different level. And this different level requires the care coordinators with the process that you are going through. So then anytime you have any difficulties, any of the appointments you are not able to make, so they are available. And also we have our facilities, since we have full control of the facility, they are participating in our care coordination events, and our nutritionists and psych and our surgeons are available. So it can't get any better than that. Right now, we are doing about 300 bariatric surgery on an annual basis, and that's probably going to be between that, like 300 to 350 in 2021. So that's kind of what we have from the surgery center side. Now, we are going to go through the type of bariatric surgeries next session, because we are going to start repeating what we did last year. So I'm not going to spend too much on that. Now, we want to talk about today, again, just go back to this topic of intermittent fasting. Again, many of you have your own issues, and many of you have your own learnings about diet and how we actually should be eating. And this is pretty different than what we learned until now. Everyone around your family, your friends, everyone says, oh, you shouldn't be doing that, because that was the teaching that was done on us is just because you have to be eating every 3 hours with small meals. It turns out that that's not the case. Well, I'm not a physician, but I do have one of our bariatric surgeons with us. So I'm going to ask Dr. Irgau to educate us on intermittent fasting. Dr. Irgau, if you can just tell us why this would be utilized by bariatric patients. So we can actually start from there.
Yes, absolutely, Kemal. So as you correctly said, we really didn't have enough time to expand on this concept during our session last time when we were talking about New Year's resolutions, and we touched upon it. Now, so essentially the question that may come up would be, what does intermittent fasting have to do with bariatric surgery? And it's important to really connect the two in terms of how we see them. First, and most importantly, just talking about bariatric surgery, which is something we tell our patients, is that bariatric surgery is a tool. It's not a magic answer by itself. So patients typically will come to us because they are struggling with weight that has been going up and up and up every year to a level where now they may be 100 pounds, 150 pounds, 200 pounds over their ideal body weight. So instead of being 150, 160 pounds based on their height, they come to us now where they are 260, 300 pounds or over that. And then at that level, no matter what they do to try to lose weight, they cannot succeed. And at this stage, we know that bariatric surgery is the single most successful intervention that we have to offer patients who need to lose that amount of weight. But at the same time, when people come to us and they've tried different diets, we don't tell them, stop eating healthy because we're going to do bariatric surgery for you. Bariatric surgery is going to replace all your other attempts. We don't say that. What we say to them is, continue focusing on healthy eating, and we will add bariatric surgery to that to make it very powerful. And in the long-term success of bariatric surgery, bariatric patients really depends on the way they adapt to a healthy lifestyle, right? So there are different ways to look into this, but the key really is to be able to control the amount of calorie that we have every day, and also have increased activity. That baseline of teaching hasn't gone away. The question is, how does one do that? What diet, what kind of lifestyle would allow me to reduce the total amount of calories that I consume every day, right? For me to stay healthy. Well, there are different diets, there are different approaches, and we see a lot of failures. But one area that I find very intriguing, and that, you and I talked a lot about, is the concept of intermittent fasting. Now, there is intermittent fasting as a practice that is independently practiced to lose weight, regardless of whether one has had bariatric surgery or not. And the idea essentially is to divide the 24-hour day into two phases, right? One would be a fasting phase, another one would be an eating window. There is 24 hours a day, so no matter which way you split it, right, you will have to come to 24. So for instance, if your fasting period is going to be 14 hours, then your eating window will have to be 10 hours. Conversely, if you decide that your fasting period is going to be 18 hours, then your fasting window is going to be 6 hours, right? So these are that is the concept, right? And the concept really arises from a very, very interesting observation. And that observation, and this is something that some doctors have been saying for a long period of time, is that one of the very important hormones in determining whether we are able to burn the calories in the fat that is stored in our body or not is a hormone known as insulin. Now, we've heard of insulin, right? We've heard of insulin in terms of its relationship to diabetes, for instance, right? We heard that people who have diabetes, some of them have to take insulin. So that word insulin, we've known about it, but we've known and focused on it in terms of its ability to control blood sugar. There is another function of insulin, which is very, very important, and that is its ability to control the utilization of fat from fat cells. It turns out that if we have higher levels of insulin, the fat cells store the fat rather than consume it. If the insulin level stays low, then fat cells are actually allowed to release fat to be utilized for consumption. So, for instance, we know that the insulin level goes up every time we eat, right? So we've eaten something, there are different mechanisms that tell our body to produce insulin, so the insulin level goes up. Well, the goal obviously is to get the blood sugar to not to rise up too much in our blood, in the bloodstream.
Like our patients from the obesity standpoint, a lot of them have the other diseases, other illnesses, and diabetes is one, right?
Absolutely,
so,
absolutely.
If I hear you correctly, so you are saying that even patients with diabetes would benefit from this?
Absolutely, absolutely. So obviously patients with diabetes, because they may be still taking some medications, they have to be much more careful, and I have to really talk to them very, follow them very closely to make sure that they don't fast for too long whilst taking diabetic medications, because that would drop their blood sugar too far down, right? But let's talk about somebody who's not diabetic, to just simplify things. For instance, what we're saying is that if we take the time in which that person is fasting, they're actually metabolizing their fat. Well, when you just said in your introduction, Kemal, that we all fast. Yes, we do. We fast every day. When do we fast? When we are asleep, right? When we are asleep, we are not eating anything at all. That is the time in which our insulin level is flat. In fact, interestingly, Kemal, studies have shown that people who don't get enough sleep actually have a hard time losing weight, right? Because if you're not asleep, you don't have that normalization of the hormonal situation that allows you to burn your fat, right? So we're saying, can we expand that period of fasting that we have during sleep during our waking hours as well? So instead of going about our day mindlessly trying this little piece of food or that little snack, can we say to ourselves, okay, I am not going to be eating from this time until this time during the day. In other words, we are expanding the fasting period that we have during the night by stopping eating a few hours before we go to bed, and then pushing our first meal of the day as far down in the day as possible, right? So for instance, if I go to bed at 10 p.m. and I stop eating, let's say at 8 p.m., Kemal, and then I don't have anything to eat until 10 a.m. the next morning, I will have fasted from 8 p.m. all the way until 10 a.m. That is 14 hours of fasting. So suddenly, my 24-hour day now has 14 hours of fasting, which means that the window I have for eating now is reduced to 10 hours. Well, let's say I'm able to go until 12 p.m. the next day without eating. Now I am at 16 hours. If I go until 2 p.m., now I'm at 18 hours. The idea is essentially, I am allowing my body to behave as if I am asleep. So the insulin level will stay flat, and I will not be burning. And I will be allowing the fat cells to utilize the fat, which means I will be able to lose weight or maintain a low weight. I utilize this technique in a modified fashion, definitely for my post-bariatric patients who find themselves struggling, right? Either because they're not losing any more weight to where they want to be, or because they've started picking up some weight because they've lost focus. And one of the interventionists I do is this. I tell them, look, tell me what time do you finish eating at night? Typically, they will tell me, I don't know, when I go to bed. I say to them, no, you have to put a curfew. You have to say to yourself, this is the hour when I completely stop eating. You put a schedule, right? So your dinner, your snack, everything will be done at that time. Whether that's 8 p.m., whether it's 9 p.m. or 10 p.m., depends on your lifestyle, your tolerance level, right? But you put a cut there, right? And then rather than waking up and going to have some sugar or something to eat, you say to yourself, yes, I'm going to have some tea, some coffee, preferably decaf, without any sugar. And then I'm going to wait a while before I have my first meal so that your fasting is expanded, right? Now, the question that comes, sorry to interrupt you, Kemal, hold on to your thought. The question that comes very often is, but then during my eating period, can I eat as much as I want? I say, no, you got to be sensible, particularly if you're a bariatric patient, you have a small stomach, so you cannot overeat anyway. So for bariatric patients who are trying to really have a good schedule, this technique of intermittent fasting, even though it's not practiced to its fullest extent, actually is a useful practice because during your eating window, you're not going to be able to consume a lot of food because your stomach is small still. Sorry to have interrupted you.
What I was thinking, just so that we can put this in the patient's perspective. So again, just so that there is no confusion, we actually have a patient who started with us, I believe it was October last year, with BMI 72. So we have limits in each settings. We have limits with the BMI. So we are not able to just do surgery on every patient. So they have to be at certain BMI level. So now, instead of just turning this patient away, what we have done with this patient is still bringing the BMI level down to 60 and hopefully under 60 before the surgery. No, normally we do actually have the special diet 2 weeks before the surgery because we want them to lose some weight anyhow. But in this one, we were able to utilize different methods to bring the patient's BMI from 72 to 60. So this was a female patient, so our ceiling was 60 for that. So this patient has a hope to actually get the surgery, which I believe we are going to be able to schedule her end of February. But it required our regular monthly visits with our nutritionist and with our surgeon. So that's how we are able to utilize this for the bariatric patients. Now, one part of that, right, Dr. Irgau? So then the other part is the lifestyle is already changing after bariatric surgery. So certain eating habits must be different. And I think this diet, my understanding is kind of aligning our goal for the after bariatric surgery better in a way that it prepares us even after the surgery. So am I right saying that?
Absolutely, absolutely. So what, we had a support group meeting last night, okay? And one of the questions that came in our support group was, how, it was actually a pre-surgery patient who was asking, I am worried that I might regain all my weight after the surgery. How can I prevent that? And I asked her, what is your main struggle? Is it because you eat a lot of food in one setting? Is it overeating, or is it because of snacking? And, invariably for the vast majority of people, the main struggle is the ongoing snacking, right? We call it grazing, actually, because, you just in a mindless fashion without really focusing it, not because you're a weak person or a bad person, just because the setting we are in, food is so pervasive wherever we go, whatever we're doing, whatever social interactions we have, there is food in the middle, right? So if we eat mindlessly through the day, even if we're not eating a lot to really stretch that stomach, just by eating continuously, we are getting a lot of calories in. So one way to combat that is to have a schedule during the day in which you say to yourself, food is off limits from this hour to this hour of the day. You do that, right? It is important, however, when we do that you drink plenty of water. Remember, you and I talk about this, Kemal, often, right? How important it is to stay hydrated. Well, there are two reasons why that is important. The first reason is because very often when we are hungry, we're actually thirsty, and we're mistaking hunger for thirst, right? So if we preemptively hydrate ourselves, there is less chance for us to make that mistake and feel compelled to eat, right? That's one. And the second point is, if we're not eating constantly, we're actually missing the water portion of the food that we eat, because the food that we eat, remember, has a lot of water in it. So the hydration part that we get from the food is going to be missed. Therefore, there is a chance for us to be dehydrated. So we have to drink plenty. Remember, as human beings, we are far more in danger of dehydration than starvation, right? We can stay for a long period of time without any single calories, and it may be unpleasant. But we're not gonna die, right? Come on, maybe difficult. But if we don't have water for more than a certain amount of hours, actually we start suffering, and our health starts suffering. And of course, we cannot survive beyond a number of hours without water. So water is urgently needed in our body, food not so. So that is the idea. So the idea of intermittent fasting is not necessarily to practice intermittent fasting the way it's practiced by people who want to lose weight just by intermittent fasting. But in the post-bariatric time, I think it helps us to get a schedule around eating. So eating gets a window during the day, as opposed to be free for all, something that we reach anytime, right? The importance of that, go ahead.
Actually is like now I follow this diet. Now I'm not a bariatric patient. Hopefully I won't be one. But if I do, I'll come to you. So yes. You are doing this as well.
Mm-hmm. Yes, absolutely.
So it's easy. So once you start getting, like, the most problematic part is like sometimes, like, we have our habits, so we need to get out of that. Now other people are eating. So like in my office, like next to me is Susan Anderson, who is skinny and she can eat everything. Now, when they order lunch, when you are about to be kind of like getting into that time, then when someone says, well, do you want to order pizza? And then you're like, sure. So now those are difficulties to get in. But once you're in it, personally, every time I start doing it and I keep it like these the holiday season, maybe not more the holiday season, but just the corona, COVID-19 itself, did have some interruption on my own diet, but I'm back to normal, hopefully. And, you know, I was just checking what my results were initially when I started. In the first 3 weeks, I lost 12 pounds.
Absolutely.
I mean,
Absolutely.
There's no reason. No one is paying us to say this, right? I lost 12 pounds in the first 3 weeks. So I was able to keep that off. Yeah. And I gained them back because of the corona, but that was very like specific change that happened. Now, back to the diet, and now you also feel much better. Yes. Like, you know, it may be difficult for people to believe in this, but it is true. So it is, you feel a lot better. Your focus is better. Even your joint pains are better. So this is actually, hopefully more people can understand and adopt. Now, Dr. Irgau, you mentioned the schedule, like the eating the duration. It really is not problematic. I mean, you know, from your own, but if you have a full-time job, and if you skip the breakfast, that's the only part that you do at home. And Monday through Friday, you are safe. Yep. So absolutely. Now, my eating hours between 7 p.m. and 11 p.m. So because I'm in the office the rest of the time, so as long as Ann Wilson doesn't get me in trouble, I'm fine. So, and I know she's watching this, and then she'll be more sensitive to my diet habits. But so
your eating window has 4 hours, which means that you're fasting for 20 hours.
20 hours.
That's very impressive.
Now, I have to tell you that I am maybe perhaps cheating a little bit. Oh. And I'm going to tell you what that is. So I'm going to show you, because this morning when I was thinking about this event, I'm like, what can I actually really share? So that's going to make it a little bit more. And I want you to actually just maybe explain this to me again. Once you see this, you are going to remember what it was. So in the morning, the only problem is in the morning, I do have some blueberries. and it's
okay.
it's this guy right here.
Ah,
Let me
yes.
see if I can rotate it in the right direction. Yep, there it is. No, not the whole thing, just the one in the right cup. So
yeah. So the question is that going to sabotage you or not?
Yes.
You know? Well, in my view, it does. It does come out, because the idea, again, is to mimic what happens when we are asleep, right? When we are asleep, we have no blueberries. In fact, we have 0 calories, right? And that's why the insulin level remains flat. And that's why there is no interference with the ability of the fat cells to release fat to be utilized for calorie purposes, in my view. So the other thing that you and I talked, and actually you touched upon it a little bit when you said we feel better when we're not eating constantly.
Oh, that's 100%.
But why is that? That is because every time we eat, we turn on this huge machinery of digestion, which is probably the most exhaustive function our body does. Because as you come up with a wonderful analogy, Kemal, we don't have a microwave and an oven. We have an oven. You either turn it on or it's off. And a single blueberry will turn it on as much as a full lunch, which means that when we turn that machinery on, we are exhausted. No wonder people like to take a nap after lunch, right? Because they feel exhausted. Why is that? Because they've turned on this machinery, right? So in my view, if we are during the fasting window, it should be water only, completely water. It doesn't mean you cannot take other non-caloric drinks like coffee, like tea, without sugar, obviously, right? But it has to be that way, so because the minute you introduce any calories, in my view, it makes it harder for your body to be fully into that fasting phase. Now, I have to caution people that what you, Kemal, are doing is called more than a warrior's schedule, because for many people will find it very hard to be without any calorie intake for the whole day until 6, 7 p.m. That's tough for a lot of people to do. But it doesn't have to be that way. It could be, much shorter than that. But if it is done on a regular basis, guess what? First of all, you will have eliminated completely those mindless snacking that you would be doing if you did not practice this type of lifestyle, right? So there is the office, the people who work near you, they may be bringing candies, they may be bringing donuts, they may be bringing something, because food is a celebratory event, right? People like to socialize with food at the center of an activity that we all participate in, right? Unfortunately, because we live in a society where food is so plentiful, everybody is able to do that with very little effort and sacrifice, which means it's easily available. And yet, it turns on this digestive machinery on us every time we snack and eat, making us exhausted, but probably making us older a lot faster than we ought to be, right, Kemal? So I do believe that putting a limit to the hours in which you eat during the day, if it's practiced in the long term, not only it's good for maintaining a healthy weight, but also it may be good for our overall longevity as well. Our cells stay younger.
That's how it started anyway, right?
Yeah, absolutely.
Initially, I think it was Dr. Michael Mosley.
Yeah, who talked about it in a BBC documentary, right?
And I watched a couple of his videos, and they're available on YouTube. So this started with the aging, because if you go back to this analogy of starting up your body every time you eat, your body is just like a car, so you have more mileage. So in one day, if you are eating 15 hours, during that 15 hours, that doesn't stop. So maybe it's a highway mileage, you may think, but like a brand new car, 5 years later, one of them has 200,000 miles on, the other one has 50. Which one you're going to buy?
Absolutely.
Right?
Absolutely.
Which one is in better shape? So one maybe same age, but they're not same age because they're used less. So now this weight loss part of it is the kind of like unintentional benefit of the aging study, actually, which makes a lot of sense. Now, I don't know how, Dr. Irgau, you can maybe talk to the moms of Italy, Turkey, Greece, all Latino countries. some African countries. So the moms are the problems too in this, right? So they want you to just eat. So it's nonstop. So that is part of our culture in many ways, because we celebrate while we are eating, or we use food to celebrate, and it's difficult to get out of that habit. And but it's not impossible.
It's not. It's not. Part of the reason, of course, like you and I talk very often, is the fact that humanity, for most of its history, has struggled to find food, right? So the greatest threat to our survival in the past for our ancestors was lack of food, right? So when we created societies, particularly in the Western world, like in the United States, where we have assurance of availability of food, right? The food becomes very cheaply available, then we celebrate that, right? And that's why we all were brought up to, for instance, finish everything that is in our plate. We felt it was a sin to throw away food because there were times in which people didn't have food. There are places in the world where food is the cause of illness and starvation and misery, right? So because we feel blessed that we have food, we feel compelled to eat whatever we have. But unfortunately, that availability of food has created this monstrous disease in our society called obesity that is actually making us die a lot earlier even than the previous generation right now. Obesity is by far the greatest threat for health in the United States right now. Obesity is the cause of the many chronic illnesses that occupy our job as health workers, Kemal, as you know, whether it's cardiovascular disease, whether it's metabolic diseases like diabetes, even cancers very often now are related to obesity. All of these diseases could be decreased if we were able to control our weight by controlling our food intake as well. And I believe creating some type of schedule mimicking this practice of intermittent fasting to some extent is very helpful. And I, without any problem, I actually talk to my patients about that even after surgery for them to stay healthy.
So one question came up from my office, actually. That means my office is watching too. Can we use creamer or sugar substitute while we are doing the diet?
Yeah, absolutely. So sugar substitutes are fine. They have 0 calories. And if they allow us really to drink the coffee that in which otherwise we would have used, real sugar, then I'm fine with that. I think non-dairy creamery is fine as well, Kemal. Non-dairy creamery is something that I tell my patients it's fine. Other heavy creams, probably not a good idea, but non-dairy creamery is fine.
How about milk?
So again, milk, remember, does have calories within it. It is laden with calories. So if we cannot absolutely do without some type of milk products for our coffee, again, we have to choose our battles, obviously. But I would prefer non-dairy creamer for the coffee if you absolutely must use some type of creamer.
Sure. So now I think this kind of covers this topic pretty well. So we may come back to it if we have more questions. Again, we explained why this is important for our patients with obesity, but also patients who are not morbidly obese. They should be following this. We personally do it, and we see the benefits. When I don't do it, I see the impact, Dr. Irgau. So it's really interesting. So like the other things that for those who may be worried about eating too much in that 4 hours or 5 hours, whatever that time is, that's really doesn't happen because I mean, I can kind of see every night, I actually don't eat as much as I used to because your body is almost pushing it in a way that, okay, I'm good. Or maybe psychological too, is eating is not necessarily your comfort zone. Like it's not taking you to a comfort zone. And I think that's more the, psych part of the issue is more problematic for many people. And probably like since we are going to do these on a weekly basis, I'll report my, I started again as of this week. I did it throughout December, but it was on and off. But now it's back to our regular Monday through Friday schedule in the office. So I'll report back to you guys how much weight loss I have. Now, before we sign out, I do want to actually mention our schedule for 2021, and I believe I have one other. That question we'll answer next week. There's a question regarding if the surgery can be done multiple times, but that's something that we can cover next week.
Yes, just briefly, Kemal, definitely we do revision surgery. We're actually very experienced with revision surgery just because we're very experienced in bariatric surgery in general. So there are situations in which, because obesity is a chronic disease, there are situations in which revisional surgery should be considered and offered to patients. And certainly if anybody is looking into that, we'll be happy to see them in consultation. But as you said, we should have a session like we did in the past where we talk about revision surgery as well, Kemal.
Definitely. So we have plenty of opportunities this year that we'll be able to cover a lot of questions and a lot of different topics. Again, Wednesday, 3 p.m. With Dr. Irgau. Second and fourth Tuesday of every month at 6 p.m. Is the St. Francis Hospital and CHRIAS Bariatric program. And then we have first Tuesday of every month, patients who have bariatric surgery through CHRIAS. It's a support group for them at 6 p.m. We started the webinar type of it last night, actually. And then we from United Medical ACO, Friday, 12 p.m. These are the different events that we have. And of course, if you are not able to catch these real time, they are going to be posted on our YouTube channels. We get a lot of good feedback, a lot of views. I see that's actually encouraging us to do more and better in a way. So we are open for any suggestions. Our goal for this type of event is to educate our patients.
Absolutely.
And educate everyone actually in a way, because this is not just one person. It's not an isolated issue for any of us. But again, Dr. Irgau, thank you for being with us.
Thank you.
We'll be back next week. Until we see you, please stay safe. Bye-bye.
Take care. Bye-bye. Thank you.